Grief and loss play significant roles in addiction and recovery, affecting individuals in complex and multifaceted ways. Understanding these aspects is crucial for effective treatment and long-term recovery. Addiction often leads to various forms of loss. First, there's the loss of life due to overdose or alcohol poisoning. Then, the loss of health, with chronic conditions like liver failure resulting from substance abuse. We also see the loss of relationships, such as broken marriages, friendships, or family ties due to addictive behaviors. Additionally, there's the loss of career or finances, where individuals find themselves unable to maintain employment or financial stability. Perhaps most profoundly, there's the loss of self and a sense of self-worth, as many individuals experience a profound sense of losing their identity to addiction. Moreover, those in recovery may experience a unique form of loss related to giving up triggering places, people, or behaviors that could lead to relapse. The connection between grief and addiction is bidirectional. Grief can lead to addiction, as individuals may turn to substances as a coping mechanism, following significant losses, potentially developing addictions. On the flip side, addiction often leads to grief, with its consequences resulting in multiple losses that complicate the recovery process. This can lead to a cycle where loss fuels addiction, and addiction leads to more loss. Grief can significantly affect the recovery process. Unresolved grief can increase the risk of relapse, as individuals may return to substance use to cope with overwhelming emotions. Grief can make recovery more challenging, as individuals must address their addiction and process their losses at the same time. Some individuals may have experienced losses during active addiction that they were unable to process at the time, leading to delayed grief in recovery. Also, recovery can involve a form of grief where, as individuals move away from the substance use, they may grieve the loss of the lifestyle, loss of relationships associated with the lifestyle, loss of identity in association with the substance, even loss of the coping mechanisms that addiction provided. As well, there may be a sense of mourning for the comfort the substance provided despite it being destructive. Effective addiction treatment should incorporate grief-specific interventions. Integrating grief counseling into addiction treatment models can help individuals process their losses and reduce relapse risk. Grief-focused group therapy sessions have shown promising results in reducing depression and cravings among individuals with both substance use disorders and complicated grief. Recognizing the role of grief and loss in addiction and providing trauma-informed care can enhance treatment efficacy. Treatment providers can act as attachment surrogates, modeling healthy relationships to help patients overcome their attachment to addictive substances. Integrating appropriate medications can help stabilize mood and cognition, facilitating participation in grief-focused psychotherapies. Individuals in recovery can employ various strategies to cope with grief. Take time to grieve. Allow yourself to feel and process emotions without rushing the grieving process. Seek professional help. Consult therapists or bereavement counselors specializing in addiction and grief. Engage in support groups. Participate in recovery-focused support groups that address grief and loss. Practice self-care. Maintain physical and emotional well-being through proper nutrition, exercise, and stress management techniques. Develop healthy coping mechanisms. Learn and practice alternative ways to cope with difficult emotions without turning to substances. Understanding and addressing the complex interplay between grief, loss, addiction, and recovery is essential for comprehensive treatment and sustained sobriety. By incorporating grief-specific interventions and providing appropriate support, treatment providers can help individuals navigate the challenging terrain of loss while maintaining their recovery journey.